All right, welcome to week 11, module 11. So I'm going to share my screen. All right, so in this module, we will have a quick synthesis of Giddens chapters 31, 32, and 35. And just remember that we did cover these chapters in module 3, week 3. But the problem is we didn't cover delirium. So the exemplar that we're going to talk about in this module is delirium, and we're going to incorporate it with each one of these concepts. And the rationale behind that is delirium is such a very important exemplar because it occurs frequently in our older adult population. Okay, so the first one here we have chapter 31 is on stress. And the definition is listed above here in the PowerPoint. So make sure you see figure 31.3. And note that the third box with the word threat at the top, this is where the clients with sudden changes in cognition due to psychological or physiological disease require secondary prevention measures with early diagnosis and treatment. Assessment can be done by using the radar tool, which you'll have more discussion in your module 11 discussion question this week. So the radar assessment tool stands for acute delirium as part of your routine. It's asking 3 simple questions while passing medication to your clients. So the first question, was the client drowsy? Did the client have trouble following your instruction, or were the movements of your client slowed down? So this tool was researched, and they're finding that this tool might be easier than the tool used in previous discussion, which was in module 3, the CAM tool. And CAM stands for Confusion Assessment Method, which the survey takes about 10 to 15 minutes to complete. So when a client exhibits delirium, this affects their functional ability, especially if they're living at home. And also it affects their family dynamics. So here is concept of stress question 1. So make sure you place that on your Word document provided. All right, concept of coping. So here is the definition above. So older adults are more susceptible to delirium due to sudden changes in their health, such as a non-diagnosed myocardial infarction, a slight stroke, changes in medications, combinations of medication because they go sometimes to many different specialists, and these specialists do not communicate with each other. Dehydration due to C. diff or refusal to take food and fluids. This affects their ability to cope and also their family members' coping ability. Obtaining a thorough medical history if possible, assessing their daily activities, sleeping patterns, eating patterns, drug and alcohol use, and if not available, then using the radar tool. The same interrelated concepts that are affected in delirium are functional ability and family dynamics is important with this concept. And that's it for this concept. So here's question 2 regarding the concept of coping. And finally, we're going to end with the concept of cognition, chapter 35. So here is the definition. So delirium is a state of disturbed consciousness and altered cognition with a rapid onset occurring over hours or a few days. During a delirious state, the individual can experience a dulled awareness of the environment and reduced ability to focus, sustain, and shift attention. Memory and judgment are impaired, and disorientation may occur. Speech can be rapid, rambling, or incoherent, sudden intense emotional swings, hallucinations, vivid dreams, and delusions may also occur. Restlessness is also common, although in some cases, activity may be reduced. Delirium is the most frequent complication of hospitalization in the elderly population. A number of underlying conditions can lead to delirium, such as dehydration, electrolyte imbalances, fever, hypoxia, sleep deprivation, adverse effects of medications, and illicit drug and alcohol use, to name just a few. It may also be the initial symptom of life-threatening problems such as pneumonia, urosepsis, or, as I mentioned previously, myocardial infarction. Delirium is usually reversible with prompt treatment of the underlying problem and management of related predisposing factors using the CAM or confusion assessment method or the radar tool might help. Delirium, like I said, can be caused by a number of variables, which include pharmacological agents, especially when they are taking 4 or more drugs in combination, is a big one. Metabolic dysfunction, dehydration, again, electrolyte imbalance, renal impairment, urinary retention, fecal impaction, acute illness, infection, or trauma. So interventions that you as the RN need to do is treat with IVs with electrolytes, give IV antibiotics, administer oxygen, discontinue medications, which is collaborative because you need the healthcare provider orders, giving glucose if they're hypoglycemic, straight cathing, limiting caffeine, and disimpacting your client as well. So here's the concept of 3. Here's the concept of cognition, question 3. And here are your learning outcomes. That's it for this module. Thank you.